I'm with Dr. Keith Walley, a UBC professor and director of the Center for Heart-Lung Innovation. Dr. Walley, the Center for Heart-Lung Innovation recently underwent a rebrand. Can you explain a little bit about what the center is doing now?
Sure. We really are about heart-lung innovation, and the area of our focus is really discovery research. So we're working with cells, molecules, that sort of thing, including samples from our patients at the hospital and elsewhere. And we're trying to understand basic mechanisms of how things work. So big projects right now in the center. On the heart side, we're looking at using new heart medications to improve heart function and improve outcome in severe infections. On the lung side, there's a lot of excitement about using some of the most recent tools to get terrific microscopic images and even almost microscopic images from CT scans to understand what's going on in the lungs when people develop emphysema, for example, or what happens in asthma. So we have big projects around heart and lung, and they have really been advanced and will continue to advance over the next several years because we recently got wonderful federal CFI funding to buy ourselves a whole bunch of important new pieces of equipment to allow us to answer those questions with even greater precision and detail.
And Dr. Walley, what are some of the goals of the center for the coming years?
Well, there's big things happening in research in Canada, I would say, and I'd say we're a part of that, and we want to be a part of it for sure. I would say the big emphasis is that all of us want our research to help out patients. And at times, research seems to be a little bit disconnected with the scientists studying very fine detail, but not necessarily then helping patients out with their new discoveries. So we're changing all that. We're in, I think, the right place. We're sitting here right in St. Paul's Hospital. Many of us, including myself, are physicians who spend a fair amount of our time actually looking after patients. So I think we have a good sense for what the big challenges in patient care are. And it's really a fun exercise to take a discovery in the basic science lab and use the understanding that arises from that discovery and figure out how we might improve patient outcomes. This is a big push across Canada to take our basic science discoveries and really help patients out. And so it's an exciting time, and that's exactly the direction we're taking for the next few years.
And Dr. Walley, you and Dr. James Hawke have worked together at the center for the past 25 years. What has it been like to work alongside Dr. Hawke?
It's been a wonderful, wonderful time. Jim Hogg is absolutely one of the leaders. We all know that. And it's just been a real privilege and exciting to work with him over the years. He distinguishes himself from any other investigator that I know by always being interested in the science. And so he'll catch you in the hall, he'll have his latest, greatest idea, and you're right into discussing the details of science, what the hypotheses should be, what the other things are that we should be looking for and looking out. And not to mean anything bad about other people, but many of the rest of us get caught up in the day-to-day challenges of working in a big hospital, in a big university, and all that sort of stuff. But Jim Hogg shines because he's always right there into the science, and it is just so much fun. He's been a wonderful mentor, a wonderful teacher all the way along, wonderful guidance throughout my career.
Thank you so much.